welcome everyone to Operation to Save Lives, the intersection of law enforcement and public health. My name is Scott Allen, the Chief Operating Officer of Operation to Save Lives, and retired police chief from East Bridgewater, Massachusetts. With me today here we have retired Arlington, Mass. Police Chief Fred Ryan and Dr. Nathaniel Horwitz-Willis, a PhD doctor and a public health leader, military veteran, jack of all trades, as part of our panel here today. And really, this is going to be an informal discussion that we're talking about a topic area that is so critically important in our nation right now. And it's talking about improving the health and social issues of our society collaboratively with public safety and public health. And with that, I want to turn it over to introduce and give Dr. Nate a couple minutes to introduce himself to the team.
When we look at the history of public health and public safety, they have operated really like in distinct silos, right? Even the use of the word police isolates, what public safety is supposed to do, and it's not by virtue of the police doing it. It's the perception and how we cultivate that. So as public health professionals, we're like, hey, look, you have a component just like we do. You're designed and you're here to keep the public safe. And with public health not working with public safety, right, with law enforcement, you create these divisions and you start to create these social situations in which we cannot heal, in the avenue of racism, mental health, even the transmission of disease.
Our second guest here, Chief Fred Ryan, who is as innovative as a chief has been in Massachusetts and across the country with behavioral health, engaging in law enforcement. Fred, how did you get that building the trust in the community, but also the building the trust with your public health counterparts, colleagues at the leadership level, to be able to have this collaborative, program, evolving?
Yeah, a great question, Scott. And really it's about, humility and going to the table with that data and bringing in public health professionals and asking for help. We approached it from listen, we're failing this population and our overdose rate is skyrocketing.